So now let's talk about the determinants of health. And just like the name says, determinants of health, they determine health, they influence health. These are things that people are going through that determine their health. And so when we think about the determinants of health, it is what public health experts refer to as the factors that influence health as determinants of health. And so determinants of health are the range of personal, social, economic, and environmental factors that influence health status. Um, and when we think about the determinants of health, we have two broad categories. And the two broad categories are non-modifiable determinants of health and modifiable determinants of health. Non-modifiable determinants of health are things that we cannot change, like you cannot change the family that you're born in, you cannot change the color of your skin, you cannot change um, genetic predisposition to something, or genetic issues, etc. You cannot change those things. That is what you are. But there are things that we can change, and we call those modifiable determinants of health. We mainly focus on modifiable things, determinants of health. Why? Because we can do something about them. Non modifiable determinants of health, we may not be able to do anything about them, but we can manage them. So that's where the management of certain things come into play. But so that's not modifiable. Modifiable things we can change. And so the number one modifiable thing that we all have control over is our behavior. Our behavior, our responses to internal, external conditions that we do have control over, that we can change. We can change how we react to things. We could change our diets. We could change our physical level activities. We could change our intellectual health. We can change these things. And so those are modifiable determinants of health. And then among the modifiable determinants of health, we have a special category called the social determinants of health. And this refers to the social factors and physical conditions and environments which people are born or live. So someone's exposure to crime, media, economic status, social support, education, job opportunities, those are all the social determinants of health. And all those things, we are able to modify them. And so when you look at the social determinants of health, it's a subset of the determinants of health. They are non-medical factors that affect health outcomes. They include the conditions in which people are born, grow, work, live, and age. The social determinants of health also include the broader forces and systems that shape everyday life conditions. And there's five main domains of the social determinants of health. It's economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and also the social and community context as well. And so when we break those down, economic stability is looking at someone's employment, income, their access to food and financial security. When we're looking at education access and quality, it's literacy, early childhood education, and health literacy. Also, when we look at healthcare access and quality, it's insurance coverage, primary care, cultural competencies, and neighborhood and built environment. We're looking at housing, transportation, and environmental safety. And lastly, when we're looking at the social and community context, this is support systems, discrimination, and social cohesion. And so when we look at CHWs, and their role in dealing with social determinants of health, CHWs are the bridge. They bridge the gap between individuals and resources needed to overcome social and economic barriers of health. CHWs focus on reducing health disparities by providing health equity. So remember, disparities are preventable differences. When we look at the social determinants of health, when we look at the health determinants, we look at those two broad categories and look at what is non-modifiable and what is modifiable. And disparities fall under the modifiable determinants of health. Those are the differences, the preventable differences. We can do something about it. And because we can do something about it, because we can modify it, then there's the solution that we can create in order for us to decrease the difference, in order to solve the problem. And how do we solve differences between groups? If one group has and another group does not have, we give the group that doesn't have in order to level the playing field. and we call that equity, right? Equity is providing resources based on need. So how do we address health disparities? How do we address preventable differences in health? We provide health equity by providing health resources based on need. And so CHWs are the ones who may be the ones who identify the preventable differences, and they're the ones who provide the resources based on need, right? If someone is uneducated on how to navigate the system, right? And we understand that if you understand how to navigate the system, you get better health outcomes. What does the CHW come in and do? They provide education, right? The disparity is the lack of understanding of how to navigate the system. And so the CHW provides equity by providing education, right? The people don't have the understanding of how to navigate the system. So the CHW provides that equitable resource of education to help them navigate the system. So CHWs focus on reducing health disparities by providing health equity. They reduce preventable differences in health by providing resources based on need. And so CHWs work across all 5 domains of social determinants of health by providing health education to improve literacy and self-care, connecting individuals to financial, housing, and food assistance programs, advocating for equitable healthcare and culturally competent providers, promoting safe and healthy communities by addressing environmental hazards, and building strong social support networks for long-term health improvement. And so when we break down each one of those, we're looking at economic stability, which includes employment, income, access to food, and financial security. So economic stability is one of the strongest predictors of health outcome, right? Because if you have money, then you can afford to get those organic foods, all the nutritional foods. You're living in a more prominent neighborhood, so you're probably not at risk of higher crime. Your also stress levels might be lower. So lower stress levels leads to low cortisol, which leads to better heart health, right? You also might be able to afford to get next or to be in environments to build more social capital, so which would create more opportunity for you that you would not get if you're in another environment, right? Money, economics is one of the biggest drivers when it comes to health outcomes. Individuals with stable employment, adequate income, and access to financial resources are more likely to experience better health, lower stress, and longer life expectancies. There are some challenges to economic stability. That's unemployment or underemployment, right? Meaning that, yeah, you got a job, but it might be an unstable job, or it might be a low wages that you're getting. Food insecurity, so lack of access to affordable, nutritious food. You're thinking about food deserts here, where there's a lack of food of nutritional value within a 1-mile radius of someone's home. Lack of financial resources for healthcare, transportation, and housing. And then also high medical debt leading to financial hardship. So how do CHW support? How does CHW support economic stability? They help individuals apply for public assistance programs such as Medicaid, SNAP, and so forth. Connect people to job training programs and employment resources. Educate families about budgeting, financial literacy, and managing medical expenses. Advocate for higher wages, affordable housing, and economic development in underserved communities. Examples: the CHW helps a single mother apply for food assistance and job training programs, improving her ability to provide healthy meals for her families. When we're looking at education access and quality, we're looking at education directly impacts a person's health literacy, job opportunities, and ability to navigate health systems. So when you think about education, education is one of the quickest ways that people of color are able um, to de- to gain upward social mobility. And so when I say upward social mobility, it's the ability to move from low income to high income, or sorry, from low income to middle income to high income. It's upper social mobility. And so through education, it's a fast track. For example, you go to school for 2 years, you get an associate's degree. When you come out, you are able to demand a higher pay than someone who did not go to school and just graduated from high school. When you go for another 2 years, you get a bachelor's degree. Now you can demand a higher pay than someone who has an associate's degree or a high school diploma. You go for a school for 2 more years. So now you're looking at 2, 4, 6 years in school, and you get a master's degree. And now you're able to get way more money than someone who has a high school associate's degree, a bachelor's degree, right? Then you go to school for another, I don't know, it depends on what type of doctorate you're trying to get. You get to get a doctorate or a PhD. And so that could take anywhere up to 5 years. But you can demand more money, right? Typically a bachelor's degree is probably going to get you anywhere between $60,000 to $70,000, maybe more, depending on your job that you have. A master's degree is going to get you somewhere into the 70s to $80,000, and the PhD was going to get you probably into the $100,000 range, just depending. So if you think about, you sacrifice and go to school, get an associate's degree, 2 years, 2 more years of bachelor's degree, then about another 4 or 5 years for a PhD, right? So you're looking at, in 9 years, you could be making $100,000. And you might be like, oh, wow, but that's a lot of schooling. Yeah, but you also could just continue on just having a high school diploma for those 9 years and never really advance within your area. Research shows that people who are more educated are able to also have a more educated family or children. And so therefore, what we end up are able to do, we are able to break the cycle of poverty just through education. We are able to have upward social mobility just through education. And so individuals with higher education levels tend to have better health outcomes, longer life expectancies, and improved decision-making skills. But there are challenges to education and health literacy. Some are low literacy rates, which prevent people from understanding medical instructions. Lack of early childhood education increases lifelong health disparities. Language barriers prevent people from accessing healthcare and community services, and limited access to health education leads to poor disease prevention and management. And so, how does CHWs help? They might do educational workshops. They might help individuals understand medical instructions. They may connect families to early childhood educational programs, and they may advocate for language access services or medical interpreters, etc. And so example is a CHW works with a refugee community to provide health literacy training in their native language, ensuring they can navigate health services. So healthcare access and quality. So access to quality healthcare is essential for preventative care, chronic disease management, and overall well-being. So barriers such as lack of insurance, discrimination, and provider shortages prevent many individuals from receiving timely care. And some challenges to it is uninsured or underinsured individuals struggling to afford care, transportation barriers preventing people from reaching medical appointments, lack of culturally competent care leads to distrust in healthcare systems, shortage of primary care providers in rural and low income communities. And then how does CHW support healthcare access is assist individuals in enrolling in health insurance programs, connect patients with primary care providers, educate communities on the importance of preventative screenings and vaccinations, and advocate for culturally competent care that respects diverse backgrounds. So examples is a CHW helps a family enroll in health insurance and finds a bilingual primary care provider so they feel comfortable seeking medical care. Neighborhoods and built environment, so the places where people live, work, and play impact their health. Unsafe housing, pollution, food deserts, and lack of transportation can all lead to poor health outcomes. And so, some challenges in neighborhoods and built environments is lack of safe, affordable housing, increases homelessness and stress-related illnesses. Food deserts limit access to fresh nutritional values or nutritional foods. And remember that are where food deserts are when Within a 1 mile radius of where you live, there's a lack of foods of nutritional value. You have a lot of like snack food, liquor stores, etc. High crime and violence rates contribute to mental health issues and physical harm. Environmental hazards such as pollution, lead exposure, and unsafe drinking water causes chronic disease. And then how CHWs improve neighborhood and built environments is connect families to housing assistance and homeless services, advocate for grocery stores and farmer markets in food deserts, work with local officials to improve neighborhood safety and reduce crime, educate communities on lead poisoning prevention, air pollution risk, and water safety. And some examples at CHW with a local nonprofit to bring fresh food options to a food desert by organizing a weekly farmers market. And so when we think about social and community context, a person's social connection support system experiences with discrimination affect their physical and mental well-being. So chronic stress from racism, social isolation, and workforce discrimination can lead to serious health problems, including hypertension, depression, and substance abuse. And so challenges in social and community context, lack of social support from family, friends, and community networks, experience of discrimination, racism, and exclusion that harm mental and physical health, adverse childhood experiences that increase long-term health risk, and low civic engagement and lack of community resources. So how CHW strengthens social and community support. They organize peer support groups. They advocate for anti-discrimination policies. They provide counseling referrals. They work with faith-based, and cultural organizations to build strong community connections. And then we think of examples. ACHW starts to support groups or starts a support group for individuals experience racial discrimination in the workplace, providing a safe space to share experiences, access mental health resources. So those are the determinants of health. And specifically, those are the social determinants of health.